Good morning, everyone, and welcome to the Wisconsin Reproductive Health Conference. This conference is hosted by us, HCET, Healthcare Education and Training, but this would not be possible without the support of the Wisconsin Family Planning Reproductive Health Association and the Wisconsin Department of Health Services. My name is Megan Arias, and I am the Training Manager at HCET, and I will be moderating this opening session today. Let me briefly introduce you to Healthcare Education and Training. Our mission is to provide comprehensive program development, education, and training to improve reproductive and sexual health outcomes. And we are an organization of passionate people who are proactive in their belief that access to evidence-based, medically accurate reproductive and sexual health education, training, and care is a fundamental right. So for more information and to keep up to date with HCET events, please be sure to follow HCET on these various social media platforms and make sure to visit our website. So now just a quick review of some housekeeping information before we jump into the opening session for the day. A link to complete an event evaluation will be available after each breakout session, located in the session folder on the website. And then a link to the overall conference evaluation will be sent to you via email following this conference. And your feedback is greatly appreciated. It really helps us in the future with future training events and things like that. You can find archived presentations and a list of upcoming events that can be viewed on our website. And if you are having any technical difficulties during this conference, please contact me at the email listed on the screen, and we will get that sorted for you as soon as possible. So here's a couple of disclosures that you will find for the conference. So just looking at an overview for day one, you'll find that we start with an opening session, followed by some breakout sessions, a break in between, then you get some more breakout sessions, and then we will wrap up the day at lunchtime at noon. So throughout the session, we encourage you to send your questions via the chat box. And to submit a question, you are going to hover over the main screen and then select the blue chat icon. And then once that is selected, a chat box should appear on the right side of your screen. And to send a question at any time during the presentation, please send it to all panelists. This is just to ensure that everyone behind the screen can, behind the scenes can view your question. And then we'll hold all questions until the end of the presentation. And for this particular opening session, Molly is requesting all questions be sent to her via email directly. But if you were to put questions in the chat box, I will gather those and send them to her directly as well. So now I'd like to introduce your presenter for today. Molly Herrmann is a consultant on lesbian, gay, bisexual, transgender, and queer health with experience training providers, conducting research with LGBT communities, and developing strategies to increase inclusion in mainstream services. She conducts in-person trainings and distance learning opportunities for a variety of audiences, including those serving victims of intimate, partner, and sexual violence, law enforcement, clergy, HIV prevention and care providers, and social workers. Molly brings over 20 years of experience as a facilitator and trainer and specializes in LGBTQ health, intimate partner violence, HIV, nonprofit strategic planning, and community readiness assessments. So without further ado, I will be turning things over to Molly Herrmann, and thank you. Molly, you're muted.
I get a second try at that. Good morning, everyone. We're gonna swap who's sharing screens here. And so, Megan, can you see the screen that says presenter with my face now?
Yep.
Awesome. So good morning. As Megan said, I'm Molly Herrmann. I'm a consultant with Humble Pie Consulting. The pronouns that I use are she, her, and hers. We'll definitely have an opportunity to talk about pronouns today. I always like to start an introduction by including my own and kind of modeling what that looks like and what that sounds like for all of you. All right, that was the test of whether I can advance my slides. So welcome to Applying Health Equity for LGBTQ+ people in family planning and adolescent health. Got a couple of objectives that I'm hoping that we'll be able to meet in our time together today. The first is that I hope you'll walk away being able to name a couple of health disparities experienced by LGBTQ+ communities. Second, that you'll be able to identify some opportunities to use more inclusive language in your first encounters with folks. If we had a full day, we'd also be talking about what you could do in your physical environment, what you could do with in-person encounters, but since we're all currently living in a pandemic and have about an hour together, I really want to focus on those first encounters and the importance of using inclusive language, no matter how we might be encountering someone. A lot of times, lately it's been on a screen or maybe on the phone, so really going to focus on that. And we all get extra bonus points if we also reinforce your understanding of key concepts regarding LGBTQ+ identities. So we're going to start our time with what I hope is an easy task for all of you, which is a visualization. The good news is that you get to sit back and relax, and I'm going to read a brief visualization. And then when we bring ourselves back to the real world, after listening to it, I'll have an opportunity via the chat box to just kind of react to that experience. So get comfortable, get that extra sip of coffee in. If you're a person who is comfortable closing your eyes during a visualization, please do that. If you'd rather keep your eyes open, find something that you can focus on in your space so that you can kind of fully absorb the visualization. So if you're a heterosexual person, this will be a very different experience than you're used to because you won't have those typical privileges. If you're a lesbian or gay person who has had a same-sex relationship, this might be a different experience for a different reason because this time you'll be in the norm or in the majority. So I'm going to read this guided visualization and you'll be asked to imagine a world that's very different from the way the real world is now. As I'm reading, just note your reactions, whether they're in the form of a thought or an image, a feeling or an emotion, or even a sensation in your body. Just take whatever you get and allow it to be there. Don't try to change it or make it go away. There's no right or wrong response to the process, and even having no reaction is okay. So I'm inviting you to reverse the world as we know it. Think of the world's population composed mostly of gay men and lesbians, with only 5 to 10% of the population as straight. Think of it always being that way, every day of your life. Feel the ever-presence of gays and lesbians and the non-presence of straight people. Think about what it tells you about the value of being straight and then of the value of being gay or lesbian. So in this world, there have only been a few openly straight legislators elected to national office in the history of our country. There are only a few very stereotyped images of straight people in the media. Gays and lesbians are the visible leaders and at the center of power. The promiscuous sexual activity of straight folks violates the social order and natural law through irresponsible overpopulation. These violations give rise to contempt for heterosexuality, and therefore all who engage in this abomination become outcasts. If you're straight, it means that you're different and unacceptable. Nobody would want to associate with you, let alone be like you. Now recall from your childhood how fearful you were of playmates who called you a breeder in teasing fun. They didn't really know the meaning of the real word, but you did. And so you learned to be distrustful and wary of everyone, to prevent anyone from learning your terrible secret. You were attracted to a classmate or teacher of the other sex. You spent your entire adolescence learning gay or lesbian social behavior. All your dating preparation, social events, and adult training were directed toward being gay or lesbian. You wanted to appear normal, so you went to the prom with an attractive person of the same sex to avoid suspicion. You may have even kissed that person or had sex with them to prove that you were gay, all the while secretly thinking of your forbidden heterosexual infatuation. Now as an adult, you're dreading an appointment you have at the community health clinic. You're worried you might have a sexually transmitted infection, and you've already canceled the appointment twice. You don't know how you'll be treated. You've had interactions with other service providers who are uncomfortable with your orientation or your gender identity or both, and you never know what to do or expect. It's the day of the appointment, and you take a deep breath and walk into the reception area. You walk up to the reception desk, and the person uses a formal greeting for gender-neutral people. You don't correct them because you're too embarrassed. You want them to use sir or ma'am or just nothing, but you don't even know how to bring that up. Then when they get to your name, they realize they made a mistake and apologize excessively. You wish they'd just let you go sit down. Instead, they hand you a form to complete before you meet with a nurse. You take the form and return to your seat, relieved to be by yourself for a minute. As you sit with the form, you realize you're either going to have to lie or leave some questions blank. The section on your marital status is confusing. Even though heterosexuals recently won rights to be married, you can tell the form hasn't been updated. The only options are single, married, divorced, and widowed. You and your partner haven't gotten married yet, so you'll have to mark single, even though you feel married after 3 years. The gender section's even worse. It lists transgender and gender fluid and then a blank. Neither term works for you, and yet you don't want to get all the questions that will come with writing your gender in the line. You check transgender and sit back in your chair. The nurse comes out and calls your name but looks right past you. You stand up and say, "That's me," but they still look confused. You can feel your face get flushed as you head back to the exam room. You just know the questions will start in right away with presumptions that you have a same-sex partner and what fertility methods you've tried. You don't know how to dodge those questions so that you can hide that you have sex with someone of another sex and are hoping to get pregnant that way. Will you lie and go along with their questions, or will this be the time that you tell them who you really are? And you haven't even gotten to the physical exam yet. So slowly bring yourself back to our real world. I want you to think about a feeling that resonated most strongly for you as you were experiencing the visualization. And if you're up for it, I'd love to see some of those one-word reactions in the chat box. Let's see, shame, isolation, overwhelmed, frustrated, uncomfortable, excluded, ashamed, outcast, anxious, excluded, sad. A couple more votes for shame and embarrassed. So first, thanks everyone for participating in a visualization right off. And as I'm reading those words, and if any of you are taking a look at the chat box, I think we can all agree that those are uncomfortable feelings, and that if you were experiencing those during the visualization, that they lasted a few minutes, but they might kind of resonate throughout the day. And the reason I do that visualization at the beginning, I think, is obvious, just to kind of get folks to kind of dive right in to what experiences might be like for LGBTQ folks seeking any kind of service. I used to say, if we've had, when I did a lot of intimate partner violence work, I would say, you know, if we've had a bad experience at the chiropractor or the dentist, we definitely don't want to have a negative experience when we're in crisis, like an emergency room or calling a domestic violence shelter. And so we carry all those experiences. If we've had negative experiences, we're carrying those with us as we encounter a new provider as well. So again, thank you for participating in that visualization and kind of getting the feeling of what folks might experience. Or for those of you that identify as LGBTQ, these might have been familiar experiences. You may have other parts of your identity that result in you feeling this way when you encounter service providers as well. So we're going to take a little journey together. I love this slide. I don't get outside enough these days with working from home with children. So I love looking at an opportunity like this where there's trees and green things. We're going to take a little journey through some concepts around sex, gender, and orientation. Every time I do a presentation like this, I'm sure to include at least some of those concepts and content areas, because I think when we don't, we often get ourselves further down the road and not as familiar with some of the terminology or have questions about the terminology that we didn't anticipate. Before we dive into those concepts, though, I wanted to take a moment just to address intersectionality and to give credit to Kimberly Crenshaw, law professor at Columbia and UCLA, who coined that term over 30 years ago now to describe the way people's social identities can overlap, and to share with you some language that she used in February to talk about what intersectionality means now, about 3 decades after she coined that term. And I think this is particularly poignant today, but really every day. So full disclosure, you're hearing a presentation today from a white person, and what I will be sharing and talking about as far as content, well, it might be inclusive of some of the experiences of communities of color. We certainly have to be careful not to just add, and and folks are experiencing racism on top of this. And so I'd like to share the words of Kimberly Crenshaw to explain more eloquently what I'm talking about. So she said, "These days, I start with what it's not, because there's been distortion. It's not identity politics on steroids. It's not a mechanism to turn white men into the new pariahs. It's basically a lens, a prism, for seeing the way in which various forms of inequality often operate together and exacerbate each other. We tend to talk about race inequality as separate from inequality based on gender, class, sexuality, or immigrant status. What's often missing is how some people are subject to all of these, and the experience is not just the sum of its parts." So I just like to remind us all that we can't just add on what we think we know about folks of color who identify as LGBTQ, that it's not just additive, but that it's an experience that for those of us that are white, we don't know about and shouldn't make assumptions about what that's like. So I'm sharing this Venn diagram, and we're going to sit on this slide for a little bit just to talk about terminology and concepts around these identities. And you'll notice that it's not labeled LGBTQ 101, but rather that the concepts of sex, gender, and orientation are concepts that we all live with, regardless of how we identify. So this is an every person's diagram. And I love using it as a Venn diagram, first of all, because I think they're interesting, but also because it shows us that there are areas where these parts of ourselves overlap and areas where they stand on their own. So if we start at the top with sex assigned at birth, we're talking about a concept where we're looking at anatomy, chromosomes, and reproductive capabilities. So for most of us, and for most of our lives, likely, we have thought of sex as being pretty clear-cut, meaning somebody's got these body parts, so we know that that's a boy or we know that that's a girl. Over time, we've come to realize that that's really an assignment at birth. It's literally a person saying that is a boy or that is a girl. So I'm sure we've all seen in movies, or maybe even experienced ourselves, baby's born, baby cries, doctor looks up and said, "Congratulations, it's a healthy girl or healthy boy." That's literally a person deciding based on external anatomy what they believe that baby is, whether that baby is male or female. What we know to be true, though, is that there's wide variation in anatomy. When I'm talking to young folks, or like my kiddos, I would say, look at how different everyone's hands are, or look at how different everyone's noses are. Why would we not expect that all parts of our anatomy would have large variation? In fact, I've heard folks say that a person born with sex characteristics that we might expect for male and female, or what we might consider less clear in terms of anatomy, so the term for that is intersex, that it's more common to meet someone who was born intersex than a person with red hair. So it's quite common that that anatomy isn't exactly like what we might expect. And And for many of us, if we have been pregnant or been part of a birth experience with someone in our lives, they might have gotten this news, this assignment during an ultrasound. And so folks are then already begin talking about having a boy or having a girl. What we often don't know about is someone's chromosomes. And so we assume that chromosomes follow anatomy. We assume that if somebody has the body parts we would expect for someone that would be assigned male at birth, that then their chromosomes are going to be XY. But we don't usually verify that. There's usually not a reason to do that. In my own story with my own kiddos, we were a little bit older when we were having babies. And when my partner was pregnant with our twins, because of age, we decided to do some genetic testing so we could prepare ourselves in case there was anything a little less expected going on for our kids, so that we could educate ourselves and learn what was going on. And so in that process, we learned the chromosomes that these two babies would have. And so in our case, as a non-scientist, I always say there were only X's in the little dish. I'm sure it was more complicated than that, but we assumed we were going to have two kiddos who would be assigned female at birth because there were a bunch of X's floating around in that non-scientific dish. So in our case, we actually knew the chromosomes, but most of us don't know. We assume that if puberty goes the way we expect it to do, and if folks don't have trouble with fertility, the chromosomes were matched, so to speak, to our sex assigned at birth. Sometimes though, folks can find out later in life that their chromosomes were not what one might expect for a person assigned male or female at birth. And further, folks might find out when they get to time of fertility, based on reproduction not going the way they thought it would be, or their fertility not being what they thought it would be, that might also be a time when folks find out that their chromosomes were not what they expected. So I already talked way longer about sex assigned at birth than it takes for someone to assign sex at birth. So you can see that there's sort of a lot more under the surface, even though most of us were taught that it was pretty clear cut. So let's move on to gender. Gender is sort of all the other stuff that goes along from that moment that sex was assigned at birth. And so gender is all the societal, how someone should dress, how they should talk, what toys they should play with, what career they should have, who they should date, all the things. And so back again on our experience when we were having babies, our first kiddo was assigned male at birth, and so we knew we were going to have this boy, and we found out ahead of time, but we wouldn't tell anybody, and it drove people nuts because they wanted to buy stuff. And so pro tip to those of you out there that are having first kiddos or thinking about having first kiddos, if you don't tell people what you're having, then you get better stuff. So in our case, we didn't get a bunch of gendered stuff, and we got more, baby gear kinds of things. So I tell that story just to illustrate how strongly people are tied to this idea of gender. I mean, they're literally saying, if I know what body your kid has, then I'll know what to buy for them. And we've seen, last probably decade, there's been definitely some movement in that area, stores changing how they do things, different colors available, things like that. But people are still pretty tied to that. And so let's look at the kind of sub-concepts that fall underneath gender. So the first one is expression. Expression is when we are walking down the street and we instantly calculate who we think someone is based on how they look. So it happens so fast. It's not like we say to ourselves, I wonder if that's a man or a woman. Oh, I think that's a man. They've already gone by. And our brain does it really quickly. And so usually what we're reading in those cases is expression. We're looking at what someone's wearing, whether or not they have makeup, what they've done with their hair, maybe even what kind of shoes they have on, mannerisms, maybe their voice. And so expression is literally that kind of read that we have without input from anybody else. If we're thinking of our more virtual world, this might be based on voice. So when we hear someone's voice on a voicemail, we might instantly think that's a man or that's a woman. And for many of us, if you identify as a woman, often you might be reading that expression in terms of safety. You might be thinking, is this a person that's safe to meet in the dark when I'm walking down the street? And so partly we're doing that just to scan our situation and see if we're okay. But we also can get it wrong. And we also might encounter people where we're not sure based on their gender expression. And so if I was in person with all of you lovely folks today, I'd ask you to raise your hand if you've ever gotten somebody's gender wrong. and I would certainly be raising my hand along with you. So sometimes we make errors based on expression. We read and we think we know who somebody is. We might even hear someone's voice and think we know who they are, and we might get it wrong. And we'll talk about what to do when we get it wrong later. But let's take a look at identity. So under gender identity, there are at least 3 categories. And so let me tell again a quick personal story to sort of illustrate that. So a couple of years ago in my day job, I was traveling for work, and 6 in the morning, the only place to get coffee in town was a McDonald's, because I was in a tiny town in Wisconsin. And so I had a coat on because it's cool weather. So I go into the McDonald's, and you all could probably say along with me what the person said. They said, "Good morning, sir. Welcome to McDonald's. Can I take your order?" So I've already shared with you that I use she, her, and hers. I will now share with you that my sex assigned at birth was female, that I do identify as gender nonconforming, and so my expression probably did not look like what the person in the McDonald's in a small town in Wisconsin was expecting for a woman. So their quick scan was, this is a male, so I need to use the sir word. So already we're down the road. I've said a lot of things already in the time that probably took me to get my coffee and get out of there. But let's talk about what happened there. So self-identity is who we say we are to ourselves. So that's how we experience our own gender when we think of it in our own heads, in our own brains. And what happened in this situation was ascribed. So that person ascribed to me a gender identity based on my gender expression. And so, as strange as this sounds, what that person was saying to me was, "I think you look like male, so I think I know what kind of body you have, so therefore I'm going to call you sir." Again, they didn't walk through those steps, right? They just read my gender expression and used what they use when they see somebody like me. What I didn't decide to do is what I've just done with you all, which is disclose. So, and I make that decision based on 2 factors. And this is common for, I think, for transgender, gender nonconforming, non-binary folks, folks who run into situations like I did at McDonald's. They're deciding, is it important and is it safe? In my situation, I decided it wasn't important, right? I was just getting coffee and maybe a breakfast sandwich and getting out of there and going to my training. So it wasn't important. It also might not have been safe. I was in an unfamiliar community, even though I grew up in a small town. I didn't know who these folks were. I didn't want to, haul out my Venn diagram and show it to them. It might not have been safe. So those are situations that folks are often encountering and trying to decide whether it's worth correcting someone. Had it been in a locker room or restroom, it might have been a little bit different. The important and safe might have gone a little bit differently. But in this case, I got my food and got out of there, and then I have a story to share with you all. So I'm going to keep us moving and look at orientation. I love a drop-down menu, so here's another one. We know that orientation is made up of at least 3 factors. One is attraction, and that's pretty familiar to folks. This is who you're drawn to, who you have a crush on, who you want to be intimate with. Usually that is the earlier part of these factors for young people. And so often you'll hear folks questioning the sexual orientation of young people if they're basing it on attraction. So sometimes young people have been asked, well, how do you know if you're gay? They know it because of attraction. And we don't often ask that of heterosexual or straight young people. There's also the behavior. So who has someone dated, been intimate with, who have they, married, relationshiped with, etc. And then identity. So who do they, again, and we'll get to you'll see the next one, self-disclose. So how do they feel to themselves? Who have they told people that they are? And what have people assigned to them? That's the ascribed part. So let's back up to that previous one, attraction, behavior, and identity. We know that for many people, LGBTQ people and folks who are not LGBTQ folks, those do not always align in a straight column. In other words, people, for example, might be attracted to folks who identify as male and folks who identify as female, but they may have only dated folks who are female and they may identify as heterosexual. So that is common and it's typical, and there's no responsibility for folks to sort of diagram this out for themselves, either with us interpersonally or professionally. But it's important to know that those are separate ways of understanding our orientation that may or may not align, and depending on your role, may or may not be relevant to what you're learning about someone and information that you may or may not need in terms of giving them the best experience possible. So a couple things before we move on. I told you we'd be sitting on this one for a bit. One is that we don't know what the first emergency is for folks. Just because somebody identifies as transgender or gay or lesbian, that doesn't mean that their orientation or their gender identity is kind of their first emergency. It might be, but it also might not be. The other thing to know is that we all live at the intersection of this Venn diagram, and that we all experience sex assigned at birth, interacting with gender identity, interacting with orientation, interacting with sex assigned at birth. So hopefully that was a helpful quick tour of terminology and concepts. My personal belief is that it's more important to understand these kind of core concepts than it is to know all the words. That said, I want to cover just a couple ones that you might hear often. So one that I've already used is transgender, so I want to make sure I provide a definition of that. Transgender is a person whose gender identity now does not match the sex that they were assigned at birth. Cisgender is sort of a sibling term to that was developed so people would stop saying non-transgender or everybody else or something like that. So cisgender means someone whose gender identity does match the sex that they were assigned at birth. And so you'll often hear people saying, I'm a cisgender ally or something like that to explain kind of how they're oriented to transgender folks in their community. I shared my pronouns at the beginning and kind of modeled how to do that. One term that I often hear is people saying, what pronouns do you prefer, or my preferred pronouns are. I'd encourage folks to kind of just take off that adjective and just use pronouns. So you'll notice that I said my pronouns are. That way it doesn't make it sound optional or possible to use whatever you want. Although you will hear people say, I'm comfortable with any pronouns as long as they're used with respect. So just sort of following the lead that folks provide. A couple other things. Dead name is a term that folks may or may not have heard. Dead name is when someone uses a birth name of a transgender person, particularly when they've asked you not to. And that can be traumatizing for folks, but it can also out people as transgender who do not want other folks to know that they're transgender. So that's obviously a practice to stay away from. And then finally, plural pronouns. More and more often, and many of you, if not all of you, have probably heard folks using they, them, or theirs for their pronouns. There are many other pronouns out there in addition to those, but I want to make sure that I cover they, them, and theirs because it's becoming more common. My experience with this was that I was going to be working closely for 2 years with someone who used they, them, and theirs 7 or 8 years ago. And it was a new experience for me. So even though I knew that there were folks that used they, them, and theirs, I hadn't experienced using that on a regular basis for someone. And so I found myself developing a couple of tricks and habits so that I would remember to do that. And I also learned an important lesson during that time, which is that we typically are using pronouns for someone when they're not around us. So if Megan and I were in a room together and then Megan left, I would say, Megan said, et cetera, and then I would start using pronouns to talk about Megan. And so the challenge with that is that we're accountable to use the pronouns that someone has asked us to use when they're not there. And that can be a challenge. Often we like to fall back on gender expression or what we think somebody should use or how we knew them before or something like that. And so it's really important, obviously, to use pronouns that people have provided to us. And one way that I've gotten in the practice of using they, them, and their more is to use it when I don't know somebody's pronoun. So I might say something like, oh, I saw a new person at work today and they were riding their bike too. That way I'm not guessing about their gender identity. I'm getting myself some practice with they, them, and theirs, and just kind of bringing that into the common language. Plus now Merriam-Webster says that we can use it as a singular pronoun. So for those of you that are word nerds like myself, you'll appreciate that that's now official. One thing that so first of all, I try not to tell people what not to do as much as possible. I try to keep it positive. But one thing I will say is not to over apologize. So this came up in the visualization where the reception person got the person's name or something wrong, identity, and they apologized excessively. So the challenge with this is it puts the person that you're apologizing to in the position of taking care of you. So they say, oh, I'm so sorry, I can't believe I did that. I knew you told me the other way and I still did it, and I even had it written down, and I told myself I wasn't going to do it. So by the time we've gotten that far, then the other person's feeling bad and trying to kind of bail us out. So it's best practice to say, I'm sorry, I knew you used he, and then move on, and then actually do it differently next time. So that's just a little reminder. And I think if you're tuning in from the Midwest, which I think all of you are, we hear over apologizing a lot. So it's a hard habit to break, but a good one to challenge ourselves to change. So sometimes I go through an entire presentation or workshop with folks and I forget to give them what words they can actually say. So I just wanted to share a few examples. I don't want you to walk away and say, oh, Molly said we should be more inclusive with our language, and then be like, but what do we say? What are the words we should be using? So here's some examples to get you started. One is tell me more about your partner or partners. So again, keeping it neutral, also keeping it open to multiple partners. How do they identify? So that's that example I was talking about. Person's not there, the partners aren't there. We want to make sure we talk about them in a respectful way. So we can say, how do they identify? What name or pronoun would you like me to use for you? So this is one that's great to get in the practice of using for everybody if we can. It gives us the opportunity to pick up on nicknames, shortened names, someone who used their middle name rather than their first name. It also kind of levels it so that we're asking pronouns of everyone. And I think sometimes we can be uncomfortable asking this because we're worried someone's going to say, well, can't you tell, or don't you know? And that's a great opportunity to say, hey, we just asked this of everybody. We want to make sure we use what they use, and we want to use what's respectful to get into. Tell me about the people who live in your house. This is a great one if we really aren't sure who the people are who live in their house, but it also makes sure that we're not assuming what relationships look like in their house. We're not assuming, I don't know how many times I've heard this as a parent of elementary kids, mom and dad. Make sure you tell mom and dad, make sure you take this home to mom and dad. Usually when teachers know our family and know that we're in a same-sex household, they don't do that, but it's almost like it's a habit. So saying, tell me more about the people who live in your house. This is great for lots of types of family configurations. It's great for two moms, two dads, grandparents raising kids, single moms, single dads, or any configuration that might be going on for folks. Who are the adults responsible for your child's care? This is a great way to get at parents and any type of guardians that might be responsible for kids. I worked with a woman who was raising her niece and nephew, and she taught me a great lesson when she said, you know, they always tell my niece and nephew, who she is raising, go find your parents. And she said, it's just a reminder to them all the time that their parents aren't currently in their lives. And she said, it'd be so great if they just said, go find your family, you know, go back and find your families after this activity. So it's a good reminder to all of us that sometimes parents isn't inclusive for lots of folks. And thank goodness there's a way to tell people that we don't know what they're talking about. So we definitely have permission to say, I've not heard that term before, or I haven't heard that identity before. What do you want me to know about you? This is a way to get the information that we need to be respectful and to provide care without being overly curious and just sort of like, you know, delving into someone's personal life. But it's actually okay to say, I'm not sure I understand what that means, and I want to be respectful and serve you in the best way possible. So those are just a few examples among many to get you started. Oh, sorry, slow advance there. And this is one of my favorite slides. What term should I use? The best term to use is the one they provide and approve. So thank goodness, we don't have to have a catalog of terms of all the things, of all the ways that somebody would identify. They provide us when we ask them with respect. And I'd like to highlight that last part that says and approve. So keep in mind that someone might, person you're working with or a coworker, I noticed somebody in the chat box was talking about a coworker, that someone might be disclosing something to you that they're not ready to disclose to everyone. So when someone discloses information around their pronouns, around their sexual orientation or their gender identity, it's okay and appreciated for you to say, is that something that's just for you and I when we talk, or is that something that you would like, you know, somebody else in the clinic you might be working with to know? How do you want me to address you when I call your home or when we're talking in the waiting room or something like that? Particularly when you're working with young people, they may be sharing with you information that's contentious in their family or information that they're not yet ready to share in their family. So it's very important that you only use that information in situations that they approve and that you don't share it beyond what you have permission for. All right, we're going to take a look at some data, and my data today is coming from a number of sources. This may or may not be a surprise that there's not an amazing one-stop shop for data on LGBTQ people and health, but that it's slowly improving. I've worked in public health and or education for over 20 years, and I will say that 20 years ago, the data sources that I am sharing with you, if they existed, which some of them did not, they did not ask questions about LGBTQ identities. So things are slowly improving, but because I'm pulling from multiple sources, you'll notice that there isn't some, you know, great repository of this information, although there's some improvement. So this first slide looks at the effects on transgender, non-binary, and gender non-conforming folks in restrooms. And about, let's see, it's about 5.5 years ago now that that there was a bill in the Wisconsin state legislature that everybody referred to as the bathroom bill. And these survey results that you're looking at are from the National Center for Transgender Equality, and they show how bathroom access or lack of access can affect the health and safety of transgender adults. This was the largest ever survey of transgender people in the US, and it was had 27,000 adults take the survey, and it was done in 2015. And so ironically, this survey aligned with the time when Wisconsin had a bathroom bill in the legislature, which, had it been successful, would have required folks to use, I mean, it's more detailed than that, but essentially required folks to use bathrooms and other facilities that were aligned with the sex they were assigned at birth. In other words, transgender women, transgender females would have to use the male bathroom, and transgender males would have to use the female bathroom if that legislation had gone through. So let's take a look at what things were like in 2015 and probably still like today for transgender, non-binary, and gender non-conforming folks around bathrooms. So 59% have avoided bathrooms in the last year because they feared confrontations in public restrooms and in other places in their lives. 12% reported being harassed, attacked, or sexually assaulted in the last year in a bathroom. Almost a third had avoided drinking or eating, so they didn't need to use the restroom in the last year. Almost a quarter had someone tell them they were in the wrong restroom or questioned why they were in the one they were in. Just under 10% reported being denied access to the appropriate restroom, so someone blocked their way or told them they couldn't go in. And then about 8% reported having kidney or urinary tract infection or other medical issue from avoiding restrooms. So I don't know about you, but I look at this and I find this very, very concerning. I also am a person who has experienced several of the things that show up on here. Primarily the first one, I've definitely avoided bathrooms or avoided drinking and eating. I think my record on a road trip is 9 hours of not using a restroom because I don't feel like there's a safe place to stop. So a lot of work is happening on the part of transgender, non-binary, and gender non-conforming folks to figure out where in the world they can use the bathroom when they're traveling or when they're just at work or out socially. So that's definitely an area that remains a concern. And if you've been, sort of following it in the news over the last several years, it's still a little all over the place. There isn't a nationwide progress on this issue. Intimate partner violence. I pulled just one statistic from CDC. This was back in 2010, and I think it was the first time that they had released the sexual violence survey with orientation in it. They do not, to my knowledge, yet have gender identity included in terms of including asking folks if they are transgender. So what you're looking at is lifetime prevalence of rape, physical violence, and stalking by an intimate partner. And you can see that particularly among women, bisexual and lesbian women experience this at higher rates, and certainly bisexual men, than their straight counterparts. Every time I look at this, I draw attention for folks back to that number for bisexual women. In fact, a colleague and I, after this data came out, did a study on factors for bisexual women because 2/3 of them experience this type of intimate partner violence over their lifetime. That statistic always really jumps out at me. So clearly there are some disparities around this issue. I did mention that there are some giant data sources that are getting better, and the Youth Risk Behavior Survey is one of them. So I'm happy to say that in 2017, we were able to get a question added to the Wisconsin Youth Risk Behavior Survey that included asking students if they identified as transgender. So the data you're looking here is sexual orientation and gender identity pushed together. So from our Wisconsin Youth Risk Behavior Survey in 2019, just last year, we know that LGBT youth are less likely to rate their health as excellent or good, only about 1/3 of them compared to 52%, almost 52% of all students, and less likely to feel like they belong at school, about 39% versus almost 2/3 of all students. And they're more likely to experience anxiety. But 78% of LGBT youth said they experienced anxiety compared to 45% of all students. I don't know about any of you, but I'm concerned about both of those numbers, and I'm astounded by how much higher that LGBT number is. So both numbers concerning, one of them just seems off the charts, which is the same, I would say, for the next one. So LGBT youth are more likely to consider suicide. 42% of our LGBT youth here in Wisconsin in a high school survey said that they had considered suicide versus 12% of all students. And having been sexually assaulted or raped, almost 21% of LGBT students versus about 5% of all students. This next slide requires a little bit of context. So it comes from the Trans Student Educational Resources, Why Support for Trans Students, Trans Youth Matters. And it's looking at a pretty specific issue. So it's looking at whether or not transgender youth have supportive parents or unsupportive parents, and the effect of that factor on these items on the left-hand column. So you can see that life satisfaction, as we would assume, is much higher for those with supportive parents than those with unsupportive parents. They describe their mental health as very good or excellent, 70% compared to 15%. Much less likely to suffer from depression if they have supportive parents, and much more likely to report high self-esteem. The last two, again, are particularly, I mean, all of these are concerning, but the last two are particularly concerning. So if a trans young person has supportive parents, at least in this survey, 0% of them faced housing problems, and 55% of those with unsupportive parents faced housing problems. Usually, this would be a case of being pushed out or running away from their home due to having unsupportive parents. And then the last one, again, we see attempted suicide, 4% for those with supportive parents and 57% for those with unsupportive parents. So I can't help but imagine, since I do a lot of work in education, that we might see something very similar if we use the words supportive adults and unsupportive adults. In other words, expanding our view of who can be influential in a transgender young person's life. And that if we know, and I think it was from the Trevor Project, that the presence of even one supportive adult in the life of a transgender young person significantly reduces the chance that they will attempt or consider suicide. So there's an opportunity here for those of you that have transgender young people in your, in your lives or in your practice at work, that you have an opportunity to really make a difference by being a supportive force in their life. So we're going to move from the data into what you can do. And when I talk with folks about this, I always emphasize this sort of two-pronged approach, and that I actually think both approaches are equally important, and that a hybrid model is probably most successful. So let me sort of break these down. The first one is specific inclusion. And so here I'm thinking of specific, proactive, obvious ways to show that you're including LGBTQ people. This could look like a message on your website that said, we proudly serve, Madison's LGBTQ community, or Black River Falls LGBTQ community, or something like that. So it's specific, we know exactly who you're talking to, and you might even say the words. This could include a visual that's a same-sex couple or something like that. Or mentioning a community event on a social media. Preventing exclusion, means making sure that anyone can identify with the language that you're using when you're reaching out to individuals. So this could look something like using neutral language, so using partner instead of husband or wife, using people rather than boys or girls or men or women or something like that. And so you can see how sort of a braided approach would work best, where you're both specifically including LGBTQ folks where it's appropriate and where you're preventing exclusion so that anyone can identify with what you're talking about. Now, sometimes when I talk with providers, they say, oh gosh, I don't think we can do that. I don't think we can specifically include. I don't think we can, you know, put a rainbow flag on our website or whatever. And that's okay. All of these are steps towards inclusion. You might find that over time you can include more and more of those approaches. So we're gonna take a tour through just a few areas of potential impact. I wanna recognize that we're still in the pandemic and that we're still, you know, not seeing as many folks in person, if at all, and probably thinking less about our physical environment in our offices than we maybe are in some cases, having different kinds of contact with people. But for many of you, you probably are getting, have been back to or are getting back to seeing people in person. So we're really just going to focus on that sort of first interaction, given the time that we have together today, and that folks are accessing information in different ways than they were 6 months ago. So we're going to look at media, first contact, and forms and questions. So when I think of media, I think of print, so sort of what kinds of brochures, flyers, posters, booklets, etc. do you have? Obviously, those are becoming less common, but still probably something that you use. What kind of visuals do you have? So do you have pictures of folks on your website, in your office? What kind of decor do you have? Things like that. Social media, what ways are you, if any, using social media to reach folks or to even just push out events that you're having? Testing events, health fairs, etc., whether it's virtual or in person. And then finally, your referral lists. So we're going to break some of those down a little bit further. So what can you actually do? So one thing I think is important is for people to be able to see themselves in the pictures of individuals, couples, groups, families, etc. that you use. This could be on a website. This could be in waiting rooms. Thank goodness there are more and more images available than there were even 10, 15 years ago. When I worked in HIV prevention, probably 15 years ago, we were looking for images to use in a brochure, and there was like one image of a gay male couple that everyone was using on everything. So thank goodness there are now more images available on some of the free graphic sites. And neutral and inclusive language. So again, that's a reminder to use lots of neutral language so that it can appeal to anyone, and also using inclusive language where appropriate. One thing that I want to make sure you take away from today is this concept that for LGBTQ people, neutral language is often seen as inclusive language. So I'll say that again, neutral language is often seen as inclusive. That's sort of how much we've been challenged by non-neutral language, that just seeing neutral language sounds like they're talking to us. And that oftentimes LGBTQ people are looking for the smallest sign that you may have thought of us, that you may have like switched things up because we're so used to seeing things geared towards straight folks, cisgender folks. I'd encourage you, if you're doing some inclusive stuff, that you're proactive, so that you're reaching out to people and saying things like, we proudly serve LGBTQ community, that you're active, that something like during June Pride Month, if you're having testing events and things like that, that you talk about that in your social media or in your print materials. And then finally, reactive. When something happens in a community, whether it's tragic or celebratory, that you recognize it, and that shows that you're paying attention to what's happening in the LGBTQ community. That you're using vetted and current referrals. So in this case, making sure that if you're sending LGBTQ folks somewhere, that you actually know that they serve LGBTQ folks well. It may be that Steve is the guy at agency A that does a great job with LGBTQ people. Make sure Steve's still there. Hear back from your LGBTQ clients and make sure that their referrals are still good ones to send LGBTQ folks to. And then finally, signature lines. More and more people are including their pronouns in their signature lines in their emails, stating their own pronouns. That can really open the door to the conversation, or also start a conversation with someone who says, hey, why are you doing that? Why did you start doing that? It's an opportunity to say, well, we want to make sure that we're welcoming all of our clients, and that we're sending the message that we recognize our own pronouns and we know they're important. All right, let's talk a little bit about that first contact. So this could be phone, email, it could be online chat. Even though we don't think of ourselves as necessarily having maybe written scripts, often we have habitual scripts that we use when we first talk to someone, whether it's in person or on the phone, and then our websites. So important to remember here is no assumptions. Remember, we can get people's voices wrong, we can get their pronouns wrong, etc. Try to stay neutral for as long as possible, and then use only what you have permission to use. So if someone has asked you to use that name only when you talk to them, but not when you leave messages, you have to find a way to remind yourself to do that. Make a note of it, so you're doing that. And that staying neutral until you get information is always a best practice. I'd encourage folks to have your websites reviewed. If you are wondering how LGBTQ inclusive that it is, ask folks in your community at a local community center to do that, and then recognize that effort either by financial reimbursement or acknowledging them as a volunteer for your organization. And ask everyone all the questions. We don't have time for it today, but you can imagine how intakes get off the rails for LGBTQ folks. And I realized last night when I was practicing this that it's particularly when sexual activity and birth control and pregnancy and fertility are combined. And that when we ask those questions together, we end up often in an uncomfortable position of assuming that someone who's sexually active is at risk for pregnancy or involved somehow in pregnancy. And so making sure that we're asking questions that sort of disentangle sexual activity from fertility, knowing that there are folks who are trying to have babies and it does not have anything to do with their sexual activity. And finally, forms and questions. And this impacts both the forms that people see, whether they're electronic or on paper, but also their interactions with reception staff. And I think hopefully that came out a little bit in the visualization. So the key here is to be ready for everyone. We literally don't know who's coming in the door, even if we've already talked to them on the phone. And that we might find things out when they fill out a form, whether it's online or otherwise, that we didn't see coming. So we just have to be kind of blank slate for anyone that we're interacting with. They may disclose something on a form that they wouldn't disclose in person, or they may not disclose something on a form that once we get to build rapport with them, because you all are going to do an amazing job with these first interactions, we might get more information when we interact in person. Making sure again that we're asking all the questions of everyone, saying these might not all apply, but I want to make sure I don't leave anything out. I want to make sure I learn everything I can about you. And then thank goodness the littlest step goes the longest way. So just folks using neutral language can go a really, really long way. And that then it gives us the opportunity to fill in the blanks, even if all of the options are not on the form. But that using neutral language, or even recognizing when a form isn't great and saying, you know, this form isn't very inclusive, so I'm just going to have a conversation with you so I can understand what's going on and so that I can know you better, even though our form hasn't quite caught up to the times. So just being transparent with folks and letting them know that you recognize that can be really powerful and go a long way. One of my personal stories about that is when we were calling to get services for one of my kids, and I called the provider and we talked through all of my information. And then when they got done with my information, they were going to switch gears to the other parent. And one of my kids' names is Eleanor. And they said, what is Eleanor's dad's name? And I was like, what are they talking about? And then I was like, oh, I see what you did there. You talked to someone who, expressed themselves as a woman, used a female's name. And so now your question is, who's the dad? Which is not the case in our house. So that's a situation, in my opinion, where the person was kind of, restricted due to the form that they had or to their habits, because I doubt the form said, ask for Eleanor's dad. It probably said dad's name or father's name. So a combination of their habits and form that needed to be updated resulted in, I'm thinking, a lot of discomfort for them too, because I'm sure we weren't the first family that they talked to that the form didn't work for. All right, so as our time winds down, and I know Megan's, if there are questions in the chat box that you're collecting them. So I wanna just do a check-in and see how we did. So I hope that as we close out the session that you're able to name at least 2 health disparities experienced by LGBTQ+ communities, and that you're also able to identify some opportunities to use more inclusive language, and that you've gotten a couple of examples of how to do that in your first encounters with folks. I hope that we're all getting bonus points today for reinforcing an understanding of key concepts regarding LGBTQ+ identities. That's the information that I was able to squeeze into the time that I was able to share with you all today and help you kick off this day of the conference. Here is my contact information. The best way to get a hold of me, oops, that didn't go well. There we go. The best way to get a hold of me is by email, mollyhconsult@hotmail.com. I'm always open to questions, wonderings, direct you to resources that I may have used. I think I saw someone asking about slides, and I believe Megan said that they would be made available. I'm always happy to share those as well. And with that, I think that we are, I'm going to take a peek here in the chat box, and I think that we are close to time. So I want to wish you all a most excellent conference, and also the fortitude to stick with a virtual conference. I know that that can be challenging, but I so appreciate your attention today, and I miss the fact that we couldn't all be in person, but hopefully reach out to me afterwards, take a peek at the slides and ask questions. I'd be happy to get back to you. And I think I end it unless Megan has anything to say. I think we're good to go. Thank you so much.